So student, the deltoid muscle is a triangular in shape. This is triangular in shape, as you can see, and this muscle has three parts. This is the anterior part, as it is located anteriorly, while this is the posterior part, as it is located posteriorly, and the part present between the anterior and the posterior is the medial part. So the deltoid muscle has three parts: the anterior part, the medial part, and the posterior part. Now student, moving toward the origin of the deltoid muscle. So the deltoid muscle has three origins. First, the anterior part originates from the lateral 1/3 of the clavicle bone. This is the lateral 1/3 of the clavicle bone. So the anterior part originates from the lateral 1/3 of the clavicle bone, hence it is also called the clavicular part. Now student, the medial part, as you can see, it originates from the acromion process of the scapula. This is the acromion process of the scapula. We have discussed the osteology of the scapula in the previous lecture. So the medial part of the deltoid muscle originates from the acromion process, hence it is also called the acromial part. Now the posterior part originates from the spine of the scapula. Student, this is the spine of the scapula bone. So the posterior part is originated from the spine of the scapula, hence it is also called the spinal part. Student, the deltoid muscle move inferiorly and laterally to the humerus bone, and it insert on the deltoid tuberosity. This deltoid tuberosity is the rough elevation on the lateral side of the humerus bone. Now student, moving toward the blood supply of the deltoid muscle. So the deltoid muscle is supplied by the thoracoacromial artery. Student, this highlighted artery is the thoracoacromial artery, and it is also supplied by the anterior and the posterior circumflex humeral artery. This is the anterior circumflex humeral artery, while this is the posterior circumflex humeral artery. Now student, moving toward the innervation of the deltoid muscle. Student, the deltoid muscle is innervated by the axillary nerve. This highlighted nerve here, this is the axillary nerve. This axillary nerve has the nerve root C5 and C6. Now student, moving toward the action of the deltoid muscle. So the deltoid muscle is responsible for the abduction of the arm, and the anterior fiber or the anterior part of the deltoid muscle is responsible for the flexion and the medial rotation of the arm, while the posterior part is responsible for the extension and laterally rotation of the arm. Now student, to overview the deltoid muscle, as we have discussed, it is triangular in shape and it has three parts: the anterior part, medial part, and the posterior part. The origin of the deltoid muscle, so it has three origins: the lateral third of the clavicle bone, the acromion process of the scapula, and the spine of the scapula. To the insertion, the deltoid muscle insert at the deltoid tuberosity of the humerus bone. The blood supply of the deltoid muscle is thoracoacromial artery and the anterior and the posterior circumflex humeral artery. The deltoid muscle is innervated by the axillary nerve, and the action of the deltoid muscles is the abduction of the arm and the flexion and the medial rotation of the arm, the extension and the lateral rotation of the arm. So this was all about the deltoid muscle of the scapular region.